call is coming through from an air ambulance flying to the Royal Melbourne Hospital from rural Victoria with a man who suffered a horrifying accident at work.
It's all happening.
Meeting Sheridan.
Sheridan, I've also got a helicopter coming, but it's a chap who's working in an abattoir. He's got his hand crushed.
Amputated?
Yes, severed at the wrist. It's hanging on by a piece of string.
Deputy Director of Emergency, Dr. Steve Pinkers, is starting his afternoon shift as the paramedics call in.
I can get a flavour for what the day is going to be like by how busy the place is already. But as to what will actually happen during the day, what cases I'll see, what patients will present, I don't know exactly what I'm going to be doing every day. That's emergency medicine.
26-year-old Chung got his right hand caught in a conveyor belt at an abattoir. And it's been almost entirely ripped away from his wrist. Chung arrived in Australia from Taiwan just a few weeks ago. He's conscious but doesn't speak much English.
Do you speak Mandarin?
Yeah.
Because supposedly this patient only speaks Mandarin. So
I can speak Mandarin too.
Oh,
perfect.
That worked out well.
Okay.
Hi everyone.
G'day, mate. So we'll get him over first, guys, before we do anything.
Paramedics and the emergency team move quickly to get critically injured Chung onto the trauma bed.
1, 2, 3.
He's a 26-year-old fellow. It's been described to me that he has put his hand up in a conveyor belt type chain arrangement, and he's sustained an almost complete amputation of the right hand at the wrist. I believe it's hanging on by some skin only. I haven't taken it down to have a look at myself. It was really well dressed. First AV crews on scene found him to be conscious. They washed it out, dressed it, bandaged, gave him some pain relief, called us, and we're here.
Okay, thank you very much. The biggest risk for us is blood loss. Because a chain conveyor is not exactly a sharp piece of equipment, it crushes as much and tears as much as cuts. We knew that he's been working in an abattoir. We knew that he had a hand injury. We didn't know the level of the injury. Was it in the hand? Was it at the wrist? We didn't know whether it would start bleeding again when we took the dressings down to have a look at it. So what I propose we do is we x-ray the limb.
Yes.
Have a look what we can see from the outside. Is x-ray here? Can we do a shoot through of the limb in dressing? Then once we've seen that, we've got plastics and ortho here. We'll undo it once, okay? Daniel, how is his pain?
Nurse Daniel Pang translates for Chung as the trauma team prepares to x-ray his bandaged hand.
9 out of 10 pain.
9 out of 10 pain.
Let's keep going some...
Yes, you've got a bad injury to your arm.
So
You're just going to take an X-ray. You're going to...
1 second.
Let's have a look.
The x-ray reveals a shocking injury.
It is. It's the hand rather than the wrist, isn't it? So it's through here. It's a single limb injury, which is basically through about that level, through like that. But with that sort of level of injury, it would be debatable whether that's going to survive. So we'll do our very best, but he may end up losing the hand. That's all right.
So, whatever we can.
We're going to need to get dressings on it.
Yeah.
So let's get some bandages, some betadine in case it's mucky.
In Trauma Bay 2, abattoir worker Chung's right hand has been almost severed when it was caught in machinery.
Because a chain conveyor crushes as much and tears as much as cuts, my concern is that the tissue is not viable.
Dr. Steve Pinkers is preparing to unwrap the bandage to see if the young man's hand can be saved.
Guys, before you start, can we just get some pain relief on board? So give it a minute, and you can keep cutting your dressings off, just don't take the primary dressing.
Removing the dressing is very dangerous for the patient.
The key thing is we don't want blood loss. And the more times you disturb the dressing, the more chance you are going to make it start bleeding again.
Let's get the tourniquet on in case we need it. We won't do it up, we'll just put it on loose. Look, it's there, it's not going to do any harm, but it's just there. It's just there. If it suddenly starts hosing, it's there. It's going to be completely mushed. OK, go for it, guys.
Chung's hand has been cut through and is literally hanging by a piece of skin. It's a devastating injury for the young abattoir worker.
Let's pop some betadine on.
Doctors from plastic surgery and orthopaedics examine the catastrophic injury before quickly rewrapping it.
Daniel, can you help the plastics reg consent him?
Chung is being prepared for urgent surgery.
When did you last eat? 今天吃早餐吗？有。什么几点？大概几点？Around 10 to 8. Okay. Thank you.
Nurse Daniel is translating for Chung as plastic surgeon Dr. Libby Shakula explains the risks of the operation.
Okay, how is he feeling at the moment? Can he talk?
Yes.
So we need to go to surgery. Can you tell him that?
我们决定就照完 X 光片呢，就要
So
把
just to let him know, with this sort of injury, the main aim is to explore everything and see what is feasible to repair. It's a pretty bad injury. Usually when it's a twisting type of injury rather than a sharp cut, it's a bit more difficult for putting things back together.
就是说你这个伤是要怎么做的，而且这个受伤比较
So we'll do our best to get the blood supply flowing again and to stabilise all the bones. He may need several other operations. The worst case scenario is if that does not work, that he will lose his hand. Has he been in Australia before?
来了澳洲多长时间？1 month and a bit.
Okay. And does he have any family or friends in Australia?
At the Royal Melbourne Emergency, abattoir worker Chung has just been told he may lose his hand after it was almost severed by machinery at work.
He's a foreign visitor out here to work, to earn money. He's by himself, he has no social supports. It's a horrible situation for him.
I asked him about where's your next of kin. He told me that his family back in Taiwan. And then I asked, do you want us to contact them? Because we got a social worker here. And he told me, no, I don't want them to worry about me while I'm in Australia.
Alone and facing a major operation, 26-year-old Chung is about to be rushed to theatre, where surgeons will try to reattach his severed hand.
It's really hard when he doesn't have any supports. It makes it very, very difficult. The problem is partly the level of injury, but also the nature of the injury. It's crushed rather than cut. And so with that crushing, you get damage to the lining of the blood vessels, and then what happens is you get clotting. And so it's much, much harder to repair the tissues. So I would have thought he has a very high risk of losing that hand.
When abattoir worker Chung came to emergency, his hand had been crushed and almost torn in half by a chain belt. Dr. Steve prepared the 26-year-old for emergency surgery in a bid to reattach his hand.
With that sort of level of injury, it would be debatable whether that's going to survive. So we'll do our very best, but he may end up losing the hand.
What?
How have you been going?
Good.
Good. You're looking a bit better in yourself today.
Yeah.
4 weeks later, Chung is recovering from major surgery, which miraculously saved his hand.
All right, well, let's have a look and see what's happening under here. It's healing up well.
Today, Chung has returned to hospital for a procedure to clean up his wound. Although he's still got a long way to go, the early signs are good.
I think the fact that we know the hand has survived is testament to the skill of the plastic surgical unit and the orthopaedic unit. The tissues were significantly crushed, and the fact that they have survived is really quite amazing.